According to the NIH, approximately 1 in 8 women will be diagnosed with breast cancer at some point in their lifetime, so early detection is essential. Though mammograms are considered the conventional standard of care for early detection, recently, a growing body of evidence has called into question their viability as an effective diagnostic tool. So before booking my next mammogram, I decided to explore another screening alternative at National Integrated Health Associates, a Washington, D.C.-based clinic specializing in blending traditional and complementary medicine, including IV therapy, biological dentistry, and colon hydrotherapy, among others.
So the numbers have come down now, but they're still elevated. Okay.
Hi, I'm Tracy Freeman. Nice to meet you. Yeah, nice to meet you. It's been a crazy day. We look at the patient in totality as best as possible, and our goal is to always figure out why the body does what it does, as opposed to medicating the problem. So it's a matter of kind of doing detective work to see why would your body suddenly stop doing, or why has your body decided not to function properly. And it's based on the belief that the body has an innate ability to heal itself when given the right tools. When you think about healthy breasts, you think in terms of having hormone balance, basically, and the thermography enables you to see if the estrogen levels are perhaps out of balance. Not that they're too high or not, but more so that the body is just a little out of whack, that you just need to be putting things back in place. It also can show you areas that are of heat, meaning that the metabolism in that area is going very fast. And so that might be an area you want to focus on and watch and give a regimen. Mammogram is more anatomical, like is there a lump here? It shows you calcifications and densities effectively like an X-ray. And then the thermography is more physiologic, more metabolic. It shows you how things are more like function, how is it working in there. So in a way they're different, but they could complement each other easily. You know, thermography I think is more preventative. What most people don't realize is that mammography is not a screening tool. At best it's early detection. And it's a little embattled right now, like there's data coming up against it, and then there's newer technologies for mammogram, and it still hasn't settled out in terms of where that's going to land. We typically will use the two together if someone has a thermography that's, it all shows a lot of heat or somewhere that's off balance. It'll be further evaluated with mammogram. I'm not anti-mammogram, you know, and it's still write scripts for mammograms as needed, but we do utilize the thermography even in younger ages where the mammogram may not work because the breasts are too dense. The thermography will still give you information.
I met with thermography technician Tammy Liner to see how it works.
The camera takes a photograph. Thermography is an infrared camera that takes a temperature picture of each temperature that's throughout the body. And there's a 16 grade Celsius temperature range. So the coldest part of your body to the hottest part of your body is generally never larger than 16 degrees. So that's how we kind of visualize the activity and blood supply and those types of heat levels. So the normal functioning temperature of the body is in the green zone, which is right in the center, and then it goes higher and lower, and based on your screening, will determine if there's activity or not. This is a screening that doesn't compress and doesn't radiate. It simply looks at the temperature that's radiating off of the screen. It can visualize anything from a dental infection to sinus infection, carotid artery inflammation, many different things. It's not like the traditional types of tests out there. Mammograms, ultrasounds, and MRIs, they all are visualizing mass in the breast. Not all masses are cancerous. In fact, most of the masses are not cancerous. Cancerous activity requires a food supply, a blood supply to feed and grow, and generates heat as it's feeding and growing, even before mass forms. It's this blood supply and this heat generation that the thermography screening visualizes versus the mass. There are many different kinds of breast cancer, you know, everything from ductal to lobular to triple negative to estrogen positive to there's many different kinds. There's also inflammatory breast cancer. Inflammatory breast cancer is rare. It's a deadly cancer, mainly because it is not visualized on a mammogram, an ultrasound, or an MRI. It is a blood cancer that forms in the breast and causes inflammatory processes throughout. Most physicians who see inflammatory breast cancer think it's an infection. Basically, this is the only type of diagnostic tool that can determine something like inflammatory breast cancer. Women are, feeling that because of misdiagnoses and, breast cancer starting at an earlier age, getting more information is going to be key for them. So the radiation factors, as many of the doctors that are out there stating that all these mammograms are not necessary, even the government saying not every year, and why are we starting at 40 when maybe 50 would be a better idea? It's because of the radiation exposure between that 40 and 50 that's detrimental to healthy breast tissue. You put this gown on and you put the snaps in the front. So Bianca, can you put your hands on your hips for me? Take a quick image with her gown on just to set the temperature range, okay? Now I'm going to ask you to make a quarter turn and I want to see your full left side. You're done! That's it, you can get fully dressed. Okay, so basically what happens from here is we submit the scans to a medical physician for interpretation. They're going to look at your screening and at your paperwork. To me, it looks pretty good. I'm not overly concerned or anything for your breast health at all. Prevention is so much less expensive than disease. Many people just want to say, give me a pill for that, or do this for me or do that for me, but they're not taking initiative to be well. And they know they could eat better, they know that they could de-stress, they know they could do better in their life and in their work and relationships and in their bodies, whether it's going to the gym or eating. Nobody's saying that anything is absolutely perfect, but taking responsibility and knowing that I could do better. Information is key, and the more information you put in front of yourself, you can make better decisions. So in conjunction is ideal. Now, how often you do the mammography is up to you and your doctor, but after you've done screenings for long periods of time, clients become much more comfortable to offering this as their main breast diagnostic, and then using mammography as a conjunctive, every 2, 3, 5 years based on their health and their history.